notion of the i10x10, where there would be specific offerings. AMIA has a process by which 10x10 courses are approved. Since the OHSU course was the original one, we really didn't go through that process. But it's an accreditation type of process. And that led to, when this was successful, we launched this i10x10. The next effort I mentioned was Singapore. And one of the things that has enabled the Singapore course to be successful is that the organizer on the Singapore side, Dr. Casey Loon, was able, through a program through the Singapore government, get a partial government subsidy. So those who enroll in the course from Singapore get some of their, I think it's like 70% of the cost of their tuition covered. And we're actually starting the 10th offering of this course. I've actually gone to Singapore at the end of each one and met with the students. And of course, here in Saudi Arabia now, we're at the culmination of the first course, and hopefully more to come. I just want to show you a screenshot of Dr. Otero in Spanish. And so just in closing, what about the future directions for 10x10? Well, we continue to track enrollment. Some say, well, maybe now we should say 10,000 trained in 10 years, but even that will expire by about 2015. I think we'll just stick with 10x10. It really has become known in the informatics community around the world as a starting point for informatics training. We've expanded to other partners. We're starting to work with a group in New York, the New York Academy for New York Society for Family Physicians. It's always important to remember that while 10x10 is a good introduction to the field, it's not necessarily the complete study of the field. So we've also changed the logo over the years. We started initially with the 10,000 trained by 2010, and now we just say that we're training next generation informatics leaders. So thank you.
Thank you, Dr. William. Our next session is going to be about two samples of the presentations that students done, and 10x10 one, and the other one was done at the third year students class. I would like to call Dr. Yasser Sami to present his 10x10 course.
Bismillah, alhamdulillah, salatu wassalam ala rasulillah. I'm really honored to be among you today, and I would have this great opportunity to thank Professor Herish and Dr. Amr Jamal and Dr. Nasriya for organizing such a wonderful course. Actually, we get to dive deep into the field of biomedical informatics, although it's an introductory course, but we've been around all of the updates of the field. So I'm trying to talk briefly about medication errors and CPOE, or computerized physician order entry. I'm going to take it into the perspective of SBAR, if you know about it, situation, background, assessment, and recommendations. So about our background, King Saud University Hospitals, or specifically KKUH, King Khalid University Hospital, was opened in 1982. We have 800 beds. It's a university healthcare facility, a governmental, it's non-private. We provide primary, secondary, and tertiary healthcare services, and we have a whole building of outpatient clinics and about 20 ORs. And of course, there's all of the expansions going to the King Saud Medical City. We provide all clinical support services. The target population is Riyadh area, which includes Riyadh city itself and the areas surrounding. So one of the departments in this hospital, the quality management department, one of these initiatives was the electronic occurrence variance report. This EOVR tool, which went live in 2013, it regularly gets reports from a lot of users in the hospital. So I know whoever view our clinicians in this hospital can recognize these two icons, which are present on most of the desktops of this hospital. So our current HIS, or Health Information Systems, is actually, we have three separate information systems. It's not a comprehensive one. One for PACS, for radiology and imaging, another one for lab access system. So the role of a physician is only, which is very passive, is only into, he looks into the lab results and looks into the radiology images and reports. And there's a third one for pharmacy, but this is inside the pharmacy department itself. Physicians does not have any role or any accessibility to it. So actually our HIS is not a comprehensive HIS or EHR in the hospital, and it does not support computerized physician order entry. So what is happening now is that physicians order the investigations in paper forms, and lab and radio staff encode the results. And physicians don't have any active role in this. And again, the physician orders for treatment for medications are again in paper forms, and with the famous disadvantages of unclear, illegible, banned handwriting of doctors, which is famous worldwide. And the paper request form may get lost, may get damaged, with a lot of patient safety implications and sometimes healthcare provider implications. So our EOVR report got to this fact that throughout the year 2013, we have medication errors which were about 7% of all the EOVRs for the year, and we can break them down to several subtypes for medication errors. But the biggest one actually was the prescribing part. Most of the errors came from prescription, which are actually the role of the physician himself or herself. And another area was about adverse drug reactions. So we are proposing, or actually it is being built right now, the solution for this paper format is the CPOA, which are computerized physician order entry. So if you want to define rapidly what are CPOAs, they're actually the process of the physician to enter electronically all the medical orders, which might include medication orders or other physician instructions, into a computerized information system which is inside the institution. And of course, only eligible staff has this access to enter this data. Ideally, as Professor Herish taught it, it should include clinical decision support, some sort of clinical decision support, but sometimes it might not include. So our new HIS, which is currently being built, and actually I'm honored to be one of the team with Dr. Khalid and Dr. Karam and Dr. Haytham and Dr. Khalid al-Junah. I didn't mention everybody. So this new HIS project supports CPOE, and our current physician build team are assigned to build these CPOEs in collaboration, of course, with the laboratory, pharmacy, and nursing. These order sets are mostly based upon approved hospital clinical practice guidelines. And the system, they call it i10x10. i10x10 stands for Electronic System for Integrated Health Information. Most of us will recognize this screen. This is one of the screens we use to build the CPOEs. So they call the solution now, they used to call it CPOEs, now they call it physician workflow. So we expect some benefits for this building of the CPOE and implementation and practice of CPOs in this hospital. We expect them, of course, we don't have any data because we didn't start go live and we don't have any studies published for this. But our expectations are they will reduce medication errors, which is related to patient safety. It will serve as a reminder for busy clinicians, which is a sort of medical education, CMEs. And it's sort of a clinical decision support system during data entry, which we are planning that they are mostly based on evidence-based guidelines. And of course, we've learned that there's a debate about the reduction of time. It should reduce time, it will save second or mouse clicks. We expect it to improve tracking and record keeping, and also improve the communication and integration of patient information. And maybe most importantly, we expect and hope that it will secure like a smooth transition between the paper system into a paper-light in the transition at the end of paperless hospital, which is our dream. Thank you so much. Hope I didn't take much time.
Our next presentation is a project that was done by third-year students when they took the health informatics course during the last semester. Please welcome Mr. Firas and Abdullah.
Good afternoon, ladies and gentlemen. We'd like to first welcome Dr. Herish to our beloved university, King Saud University College of Medicine, and I hope that you enjoyed your 36-hour stay here. My name is Ras Gumrawi. This is Abdullah Halali, and on behalf of our group, A1, third-year medical students, we'd like to... Just a second.
It's not working.
There's something wrong with the presentation dynamics.
اضغط هنا دكتور هنا عشان طيب ايوه.
Okay, so on behalf of our group A1, my name is Ras Gumrawi. This is Abdullah Halali. We're going to present the topic of our discussion today, which would be the Accelera ecosystem. Now, as you can see in the presentation, can you please? Yeah, there are 6 elements for our presentation today for the outline. So we're going to talk briefly about the system with its description and advantages. Abdullah is going to start with the description.
Okay, good afternoon, everybody. We are going to talk about system description. As you can see here, the organization that introduced the Accelera system and runs it is King Fahd Cardiac Center here in King Khalid Hospital University. As for the system, it is an integrated multimodality cardiovascular imaging system, deals with echocardiography and catheter, as well as with other modalities. As you can see, it was implemented and maintained by Philips company. It is a vendor-based system, actually.
So after we've had a little description and introduction about the system, let's look about how the Accelera helps us in the clinical setting. Now, since the Accelera system is closely connected to the cardiology department and the cardiology sciences, it helps us a lot in the diagnosis of heart diseases radiologically. That is storing and reporting some radiological images, and also in comparing, for example, between images at the same time for different patients and so on and so forth. Now, the benefits are not solely clinical. There are also educational benefits. Now, for example, the radiology department the radiology professor would want to present a lecture to us students, and he would upload the images from the Accelera system to show it to us. Also, in the research sector, it helps a lot in statistical analysis and also in comparative studies, for example, between different cases and other research purposes.
Okay, so how does it work? It's rather a simple process. First of all, the technician performs the ordered modality, let's say an echo. Then he uploads those images to the Accelera system. After that, the treating physician logs into the Accelera system, goes to the patient ID, and click on the relevant image. And usually it is attached with the full report of the procedure. Then he either contact the technician for more images or with different technique, let's say a Doppler, or he can compare it with the previous archive of the patient to detect any changes or abnormality, and finally document the findings. After all of this, I think we can summarize the system functionalities into 4 main functionalities: statistical comparative studies, image documentation, storage retrieval, reporting certain cases, and educational purposes, as my friend said before.
Now let's look at the Accelera here in the hospital, how it was implemented and how it's maintained. Now, basically, the Accelera system has been developed and maintained by Philips company, the world-renowned electronics company. It's a vendor-based system. Here it was implemented in 2011 and took 2 years for implementation. Now, the main users of this system are cardiologists. And for their convenience, this system has been situated all around the hospital for better use by the cardiologists. There are secondary users by, for example, the nurses and the technicians of the cardiology department. And the third parties or external parties have only limited access to the information so as to preserve patient confidentiality. Now, when we went to the system and interviewed the professor who was working on the Accelera system, we asked him, was there any training for the users for the Accelera? He said that he was self-trained and all of the experience that he got from using the system was by using the system on his own. And also, there is no continuous educational program for users for the system.
As with any organization trying to implement a new system, there are some challenges or issues might arise. For the department, those issues were limited storage space for the images and the lack of the local technical support from the original company. That is, if any difficulties arise, they need to call the Philips company and they have to wait for their support. To overcome these challenges, the hospital administration has come with two solutions. Of course, expanding the storage capacity from time to time, and also training the local IT department in our hospital. So rather than waiting for Philips company, they call our IT department here and they solve the difficulties.
Now, in conclusion, after we've done the field trip, we gathered up with our fellow students in Group A1 and discussed some of the learning points and some of the suggestions that we can use to help, for example, develop the system. Now, as for the learning points, we've chose from the pool of opinions. The most important is that the system enhances the quality of the service provided by the King Fahd Cardiac Center for better diagnosis and all that. The system also provides fast, effective access to the patient imaging from anywhere in the hospital, thus increasing convenience. The system decreases medical errors and aids clinical decision-making, as in all electronic systems. Also, the system helps in performing research on patient data, as has been stated before, and the research benefit. And finally, as a golden rule, we've reached to this conclusion that the computerization of hospital procedures is always beneficial for increasing the quality of care. Now, as for the suggestions, we hope that they get taken into consideration. We suggest that they should provide limited access for us, students who are interested, for example, in cardiology. Of course, coupled with an educational program just to learn about the pros and cons and how to use it professionally. Also provide limited access for patients for their imaging records and to access, for example, their reports and other things. I've said this before. More advanced training programs and continuous assessment for the users, as has been discussed in the problems, the managerial issues that have arisen with the system. One of the other problems was the lack of a local representative from Philips company to address any technical issues. I mean, it would be better for them to address that problem. And last but not least, the center should combine a lab order system with the imaging system to make the decision-making faster, so as to aid in better clinical decision and increasing the quality of care. Now, in conclusion, I'd like to thank you for your kind attention. I'd also like to thank Dr. Amr Jamal and Dr. Nasriya for giving us this opportunity to actually present this presentation that we did on the CIS Day. And we'd like to thank them for their support, and we'd like to thank you for your attention, and hope that you enjoyed our presentation. Thank you.
Now I would like to call Dr. Abdurrahman Al-Ma'ammar, the Vice Rector for Health Specialties at the University, to patronize the ceremony. Please welcome Dr. Abdurrahman.
Bismillah ar-Rahman ar-Rahim. Ladies and gentlemen, it's a great honor for me to be part of this activity today. I still remember about 10 or 11 months when Dr. Amr Jamal approached me, bringing the idea of inviting people from Oregon to initiate the program, 10x10 program. At that time, to a certain extent, I realized the importance of health informatics, but I can tell you, in the last 10 months, understanding for the concept of health informatics and the importance of health informatics for all health practitioners grew by 100 or 200%. And I can assure you all that we are now in the era where we need people who can utilize this concept very well. It's unfortunate if we look at our health education in the kingdom that we are limited to only one school who provide bachelor degree in health informatics. And also it's fortunate for us as a KSU that since it is quite premature for the kingdom to proceed in this part of science, but we were quite lucky that we initiated the unit under the medical education department, and hopefully this unit will grow with time and exceed our expectations soon, inshallah. Again, we were able, with the help of a public health master program, to initiate a track for master degree in health or medical informatics. If you look at the kingdom map, you realize how important to spread the concept of health informatics. We know that we have multiple cities, villages, where actually physicians spread all over through the kingdom. It's always been a problem for our physicians, nurses, practitioners throughout the kingdom to have an access to all the new information, approaches, and update in health in general. But I think if we all work hard, the new physician, the existing teacher, and the leader, I think we can reach all the practitioners throughout the kingdom, so we can introduce the concept, we can bridge the gap in terms of all the update in health in general and in health informatics. And this definitely will reflect on the health throughout the kingdom and for our people and community. I would like to thank Dr. Herish and his group, and I think we really appreciate as a university the effort you did, giving us actually the pleasure of having this program. And if I'm not wrong, are we the only one in the Middle East? Or? Yes. And we really look forward, and I think the next time we have to bring all the leaders in the hospital and the college to be actually candidate for the course. KSU will continue supporting this course and all the other events, and hopefully until we can establish our bachelor degree, master, and upgrade the master and reach to the PhD and reach as many people as we can. Thank you all. Thank you, Dr. Amr Jamal, Dr. Sami Nassar, for all of the department, individual, all the students who contribute efficiently in conducting this course. We are very proud of all the people in the university, and we would like to continue spreading the knowledge throughout the kingdom, inshallah. Assalamu alaikum.
Now we would like to call Dr. Sami Nassar, Chairman of Medical Education Department, and Dr. Amr Jamal, the Head of the Medical Informatics Unit, for the award ceremony. First, we'll start with Dr. Abdurrahman Al-Muammar. We would like to thank him for taking the time to attend and distribute the awards for our students. Can you, yes, Doctor, thank you. Dr. Herish. Also would like to give an award to Dr. Herish for taking the time during the past 3 months to teach the students of the 10 by 10 course. Thank you, Doctor. Also, there is an award for Dr. Fahad Zamil, the Dean of the College of Medicine, for his dedication with us to make this course successful. Dr. Umar Al-Abaid will receive this award instead. Dr. Sami Nassar also is thanked for his hard work with us during the past months. One of our speakers today is Mr. Russell Gann, is not present now. Okay, we'll give him. Then Mr. Keith Bone for giving an excellent presentation today before afternoon. And also would like to thank Dr. Ahmed Al-Barrak for his excellent presentation that was delivered yesterday about medical informatics education in Saudi Arabia. I also would like to thank Dr. Ahmed Bilkhair. He's not here too. And Dr. Amr Jamal for leading the course during the past year. And Dr. Nasriya Zakaria for also teaching the course. Now is the time to congratulate the 10 by 10 graduates and award them their certificates. We'll start with Shahinaz Abid, or Dr. Shahinaz Abid. Also Miss Al-Alawi, Fatima Al-Alawi. Al-Alawi. And Dr. Tamim Al-Ghannam. And Khulud Al-Ghamdi, Muna Al-Hakim, and Ustad Faisal Khairi, عفوا أستاذ فيصل الكثيري. بدرية المطيري. الدكتورة لولو النعيم. الأستاذ ياسر عامر أو الدكتور ياسر عامر. أستاذة مرام بخش. مستر كورم باهاتي أو دكتور كورم باهاتي. أستاذة هبة رمال. أستاذ محمد هاني. دكتور هبة رمال. أستاذ خالد الجنيح.